All right, good afternoon, everybody. Thank you for taking the time to come join us today. Gonna run through our monthly meeting here pretty quickly. Welcome. I see a couple names I know, but I haven't always seen you in this meeting, so thanks for hopping on and joining us here today. Just wanted to toss a kudos out there to Lincoln County. Their crew chief answered the other day. They were helping us with our first discharge home with a TPOP pulse form in place here in Missouri. So that was the first time with us, and they were able to get the form and then go share it with all their crews and talk through. So hopefully we can continue to try and provide good support to those families. So thanks to their crew chief and their crews for that. And then wanted to give a shout out to MedStar for a call I'm going to review here pretty shortly. And by that, I mean on the next slide. All right. Just wanted to give a shout out. This was a February call for this crew for one of our heart kiddos over in Illinois. This was a BLS crew on both fronts, 5:30 in the morning, because just making sure that you're up and ready to go. They did get a set of vital signs for the kiddo, and you can see they were getting room sats of 70% on room air, which was beneath the patient's thresholds. If you, I won't read their whole narrative to you, but kiddo woke up seizing, possibly some aspiration. Family did give home diastat, and the kiddo vomited afterwards. And so you can see that they did note that they didn't think the SAD seemed right. They compared it against the correct ones. They did request an ALS intercept, but one was not available, and so this crew did the right thing and just a little bit of oxygen and ended up running directly over to here to us, so direct to tertiary. And the last set of vital signs on the trip there was 80%. So they got the kid back up to normal threshold. So really nothing crazy, nothing mind-blowing, cutting edge care or anything like that. But I mean, this is exactly what it's here for, right? To give you what should be basics for the kids, and this crew did everything right. And I just especially wanted to call out as somebody like many of you on here who had to run a BLS crew a couple times in your career, and those terrifying days, just to show you they can do it too. So kudos to that MedStar crew who took care of that. Did want to give you guys just some changes that we were putting in on the program. So we do have the info website. You can access it from the top of the navigation in the STAR site, or just go to info.starsprogram.org. We're going to continue to put those resources in. They did roll out since our last meeting, even though I think I discussed them some in the last meeting. But for especially those of you who interact with families, if you want to use some of these documents to help support those trips. We did update the wording on the parent guide to 911 and the family travel letter, making them much more family appropriate. And then we're in the process of getting those translated into Spanish. We'll do additional languages as necessary. So that'll be available in the info website. And then there's a new section with some of our interest and emphasis on helping our families be prepared for disasters. There's some links to some national resources in there as well, some plans to help them get ready, or communication plans, things like that to be ready for a disaster. So just especially for my coordinators who interact a lot with the families, those are just some things to be aware of. Did want to let you guys know that on April 1st, we will be rolling out the post-call surveys. These will be red cap surveys. We're going to put the links to them in a couple different places, both for EMS and for families. EMS, there will be QR codes and tools that can go in the break rooms at the EDs. And then additionally, it'll be available through the STARS website. For the families, we will have a tool packet for the charge nurses at the EDs to be able to share with staff so we can capture the data from the families. I did put the majority of the questions up here. it's pretty straightforward. It's QI work for us, just to let us know how the system was being used and identify opportunities for improvement. I did want to make sure I don't know I got you moments. I want to make sure you guys know like the families will be getting them as well. Just this is so families also can give us the feedback on how to improve. And we hope to use both of those together to really improve how the plans are distributed and available for an emergency. So like I said, they'll all be on the STARS website, ED flyers. Um, for my EMS champions and coordinators, I think the tool we're going to use for the ED probably will work just as well if you have an interest in printing it out and hanging it on bulletin boards in your stations. It's not particularly time sensitive. We just obviously as close to the call as possible. If we could capture the information, I'm sure we'll get the more accurate reflections on the call. So that's certainly not a mandatory element, but it would certainly be helpful to us. So if my STARS coordinators are willing to hang those somewhere in the houses, we'd appreciate it. We'll distribute those via email with the notes from this meeting. Actually, I take that back. We will distribute those on April 1st because I can't have you guys filling up the survey prior to April 1st. So April 1st, those will roll out. One other change that's coming in, we talked about, for those of you who've come to these for a while, we've previously talked about some potential calls where EMS crews can call and contact the specialist directly regarding a kid that they're on a call with. And so it was previously like sometimes some of the palm vent kids or kids who had undergone a lot of flights, and there was just this question of do we want to contact from the scenes. But we had a really productive meeting with the Glennon cardiology team over the last couple weeks. There were two meetings. And kind of what came out of that is that they do have an interest in just being available as a resource whenever there are 911 calls going on for the cardiac kiddos. And a way you can call and talk to them either with questions regarding care, and or if you just really want to double check, prior to a refusal on scene or a discharge from the community hospital. And then that helps cardiology know to follow up with that family a little bit faster. And so what you're going to start to see, it won't be for every single cardiology patient. Obviously, there's a big difference between whether they have an atrial septal defect that's going to heal off within the next couple weeks. But for our major syndromes, our hypoplastic lefts, pulmonary atresias, all of the more significant critical congenital heart defects, we're going to start to have this note in there. I'll try to follow up this with more information to the coordinators so we can start to teach on this. But we did want to lay it out in the note as well. Like just if you're sitting there and this note's in the STARS form, like you can pick up the phone, you can call the access center and tell them what STARS patient you're with, and they'll connect you through to the fellow or the attending on call with cardiology. And so we're hoping to kind of test this proof of concept. I think it'll work well. And if it works really well for cardiology, I think there's the potential that we might see this idea spread. I really hope it's more helpful to EMS providers, maybe to talk to the specialist. I know there will be maybe a slight translation gap as specialties not always aware of what EMS can do. But I think this might be more helpful even than trying to call the emergency department, who are often overrun and not always, as don't have as much time to kind of really guide, should this be a transport, not a transport? Should we be doing something way outside normal protocols or not? So we'll follow this up closely with the surveys, but really have some high hope that this will lead to in a good direction. On the note and just to kind of talk through, the cardiac kids, I mentioned this briefly in the last meeting, but I just kind of wanted to talk through it again. The cardiac kids are kind of their own special subset of the STARS patients, in that we have these amazing surgeries and these amazing things that can be done for them, and it really has significantly changed life for some of the cardiology patients over the last couple decades. But that being said, in the early stages of their repair, that's still a very vulnerable, high risk time period. And we had a patient who did pass away in February. The crew did amazing by them. It was a very young, nearly brand new paramedic. But they did a great job on the call. They went to the closest hospital. The patient was worked for a very long time at the hospital, and they did everything that they could. So, um, something just a reminder, that it is still a possibility for these patient populations as much as we've tried to diminish mortality for them. So we are certainly available both for clinical support if you need us in a meeting just to talk about the risks and some of the things that can go on with the patients, and also for caregiver support. I think, EMS can be pretty hard on themselves, and we certainly always want to do better, but it's important to understand the full context of, if a young 2-year-old passes, well, if they had a lot of this history, it's important to understand through that lens that this was a higher potential than your average 2-year-old, and maybe, just we can improve, but not to beat themselves up too much clinically over that. So, and so just to go through our usual numbers, so there are the maps. Added 23 new kids since our last meeting. That seems to be getting to be a pretty consistent number. And user logins, Central County one for all 28 February days, followed closely by Collinsville and some of my other dispatch agencies. For dispatches, we had more in January. We dropped off a little bit in February. We'll blame the shorter month, but we're chasing them again here in March. Emergency activations was actually way up for February, so 180. And then that breakdown of reasons for accessing. So we're actually seeing a lot more care plan reviews and education and training, and then the care plan updates. So I actually think that's awesome because that speaks to our mission of wanting EMS to know about these kids prior to the emergency with updated plans. And so I think it's only right that the system will heavily tilt towards preparation versus emergency access. We had 35 911 transport calls for the month of February, 3 non-transports, seeing about 2/3 referencing stars in their PCRs, and directed tertiary on 23 calls that we knew the details for. As far as reasons for the 911 transports, as you all know, I can probably skip past respiratory and seizure, which always dominate, but your next lower categories there were sick cases and fever. So that probably is also in alignment with the heavy amounts of flu that we've seen rolling through our children's EDs. And then you can see the breakdown for the non-transport calls. As far as for February EMS management, we had see one BBM. You already saw an example of one of the blow-bys, just nasal cannula, non-rebreathers. So no trach management for this month. And then medications, we had a kid with actually pretty significant history of tracheal stenosis and respiratory distress, and they got some dexamethasone. And then Versed for some seizure kids. We did have one case, and I'm going to talk through this kind of briefly, but this was a room for improvement and an error that was addressed at another site. But we had a crew that attempted to administer adenosine through a G tube. Now that for many of us, that's kind of a head scratcher, but I think it speaks a little bit to and just an awareness. It was a first responder non-transport crew who arrived, and mom, the caretaker, said they have this line for specialty medications. Just showed them a line coming out of a set of clothing, and so the crew proceeded to administer it, without really the knowledge of where that medication was going, and how that wasn't really going to work, and some mild risk for harm. So that just as always a takeaway, we certainly want to utilize our caregivers to the max, but we do have to be healthcare providers when we're interviewing those parents, and sometimes understand that they can't always fully translate. So that I would have probably had some hesitations just slamming adenosine through a central line. I would have done it once I was sure what it was, but like this is one of those where we do have to be a little cautious. We cannot take medical directions from parents to do a lot of our care. We do still need to be more informed. It's got to at least come from the STARS form, your protocols, online medical control, before we access things that we're not sure what they are. So it was just a bit of a learning lesson and hopefully something we all can learn from. MD care plan approval continues to actually drop, so kudos to the docs, and we're getting a little bit faster approval. So it dropped from January to February. Some education opportunities. I'm going to throw this up, but I will acknowledge I think there was only one spot left in this one for the SCAD date, but there are some additional dates coming up in both Missouri and Illinois for additional training sessions. So I don't know if there's someone on here who could speak to that, or if there's going to be an additional sign up. Do I have a Danny Lee or a Kelly Rydell?
Hey Nick, it's Danny.
Hey, Danny.
Yeah, so there'll be the next date will be in June in Illinois, and we'll put the sign up for that probably out at the end of April after this class. So same flyer, different location. But yeah, I'll make sure. And then we do have the Missouri one is coming up in October in Washington, Missouri. So down in close to Franklin County.
Okay, cool. Awesome. Thank you, Danny. Be safe driving. The SSM EMS Medical Direction Group is going to continue to put on their Breaking the Stigma class. They have 3 more coming up in May. So certainly always encourage any of your providers to attend that. I'm sure they would be happy to welcome anybody who wanted to attend. The 3 in May will be hosted at Rock Community Fire down in Arnold. So there is the link for that if you have any interest in that. I will also say on the topic of that course, their goal is to continue to provide that throughout the region. So if you're a potential hosting site who would like to talk to them about hosting, I'm sure they would be very open to that. And then we have the QR link for any specific education request you have, whether that's for the STARS team or any other pediatric education that is available via that QR code. So we will, just one more change that'll be coming, and it might hit before our next meeting. But we're continuing to work on that project where some coordinators and admins in the STAR system will receive a lot more messaging about what's happening to your plans. Whether a kid who was already a live STAR gets moved into your area or they start to attend school in your area, if we add your agency, you'll receive an email about that. You will also be notified when plans move out of your system. So if the kid graduates or they move out of your area, you'll receive all of that. But hopefully that will help, especially my agencies who track their stars outside of the stars database or do extra things with them. Hopefully that's helpful for all of you to kind of see where the kids are moving to and going to. So cool. So I will leave it on this QR code. That was everything I had prepared for content for this month. But I'm happy to hang on. Were there any questions or concerns? Anything anybody need to bring up?
Hey Nick, it's Stephanie. Did we invite you to April 12th?
I think I might have gotten a save the date, but I don't know for sure. Is that the Easter?
Yep.
Okay. I will make